Welcome to Indian Anatomist. FMGE, Neet, Next 2024, PG exclusive test series. Today, we are going to discuss a topic from upper limb. Which one of the following muscles does not receive its supply from the median nerve? The choices are A. Second lumbrical, B. Flexor pollicis brevis, C. Abductor pollicis brevis, D. Flexor pollicis longus, and E. Adductor pollicis. First, we'll talk about the 5 choices before you make your final decision, so stay tuned. From the choices, find the odd one out. That is, the flexor pollicis longus is one of the extrinsic muscles of the hand, since it originates in the front of the forearm and inserts into the palm of the hand. Dear aspirants, this not the answer for this MCQ. The remaining muscles, that is the options, A, B, C, and E, are the intrinsic muscles of the hand. Which muscles of the hand are considered to be extrinsic? The forearm is the source of the extrinsic muscles of the hand, which can be located on the forearm's anterior and posterior compartments, also called as long flexors and long extensors, respectively. These muscles are responsible for performing the fundamental actions of the hand and wrist, such as grasping firmly or grip movements. Now, what are intrinsic muscles of hand? The intrinsic muscles of the hand are made up of tiny muscles that are only found within the numerous osseofacial compartments that are present between the wrist and the phalanges. The intrinsic muscles of the hand serve the purpose of modifying the hand in order to perform fine skilled movements, like writing with pen or threading the needle. In addition, it also serves for gripping movements. There are 20 muscles in palm, grouped into 4 regions. Laterally oriented, Thenar Eminence. Medially, Hypothenar Eminence. Middle, or central region of palm, which includes the 3rd and 4th regions together, contains the lumbricals and interossei. In addition, the central region also contains blood vessels, nerves, and tendons of long flexors of hand. Next is Sphinar Eminence. The Sphinar Eminence is the elevated area, or surface bulge, that forms at the base of the thumb, on the palmar surface of the lateral hand. This bulge houses the underlying 4 intrinsic muscles that are responsible for the movements of the thumb. They are abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and adductor pollicis. It is essential to be aware that the Sphinar Eminence, containing the adductor pollicis, is responsible for adduction of the thumb. Few anatomical textbooks omitted the adductor pollicis muscle from the Sphinar Eminence because of its variable nerve supply. Hypothenar Eminence. The Hypothenar Eminence is the muscular bulge or elevation that can be found on the ulnar, or medial side of the palm of the hand. It is situated below the base of the pinky or little finger. This bulge is caused by the underlying hypothenar muscles. The muscle group targets the little finger. The following are the 3 muscles: flexor digiti minimi, abductor digiti minimi, and opponens digiti minimi. The palmaris brevis muscle is sometimes called as muscle of the hypothenar group. However, it is not part of this group because it lies in the superficial fascia of the Hypothenar Eminence and does not move the little finger. Palmaris brevis, a subcutaneous muscle, produces wrinkles on the ulnar side of the palm and deepens the hollow or middle portion of the palm by emphasizing the Hypothenar Eminence. Now, it is the time to discuss about the lumbricals. Lumbricals are 4 short, that is, 1 to 4, or lateral to medial, intrinsic hand muscles, are positioned between the metacarpal bones, but deep to the palmar aponeurosis. In Latin, lumbricidi means earthworm, hence, these muscles look small worm, so called as lumbricals. For gripping, the hand's lumbrical muscles, flex and extend the fingers at the metacarpophalangeal or MCP joints and interphalangeal or IP joints. These muscles originate from 4 tendinous lips of flexor digitorum profundus, and insert into the lateral edge of the dorsal digital expansion of the extensor digitorum muscle, at the proximal phalanges of digits 2 to 5. Aspirants, remembering the lumbricals' nerve supply and actions are important. What is action of lumbricals? Please remember the mnemonic for its nerve supply: 1 to me, 3 for you, 1 to me, 3 for you, that is first and second lumbricals, supplied by median nerve, and third and fourth lumbricals are supplied by ulnar nerve. Now the interosseous muscles in brief. The interossei muscles are those that are situated between the 5 metacarpal bones that make up the hand. As their name suggests, these muscles connect the metacarpals. They can be categorized as either palmar interossei or dorsal interossei, depending on their orientation. There are 4, sometimes 3 palmar interossei, which are responsible for adducting the fingers. Whereas, there are 4 dorsal interossei, which are responsible for abducting the fingers. In addition to the functions that they do, the palmar and dorsal interossei also aid the lumbricals in flexing the metacarpophalangeal or MCP joints, and extending the interphalangeal or IP joints. Please, remember the mnemonic for the action of interossei: R. PAD means palmar interossei for adduction. DAB, dorsal interossei for abduction. Last before. Dear medicos, we have named 20 intrinsic muscles of hand. Next, coming to the nerve supply, to these muscles. 1. Median nerve supplies 3 thenar eminence muscles, while deep branch of ulnar nerve supplies the adductor pollicis. 2. 3 hypothenar muscles are supplied by deep branch of ulnar nerve, while palmaris brevis is supplied by superficial branch of ulnar nerve. 3. Median nerve supplies first and second lumbricals, whereas deep branch of ulnar nerve supplies third and fourth. All the palmar and dorsal interossei are supplied by one and only deep branch of ulnar nerve. So, the ulnar nerve supplies 15 of the 20 muscles, while the median nerve supplies 5. Dear medicos, most likely, you may have chosen the right answer for this MCQ. The question is, which one of the following muscles does not receive its supply from the median nerve? The correct answer is E. Adductor pollicis, which is supplied by deep branch of ulnar nerve. Hope you enjoyed by hearing. Thanks for watching. Please like, comment, subscribe and share. Good day to you, all.